Today I am going to be going over intradermal injections. I am going to, of course, identify my patient. According to agency policy, I am going to attend to standard precautions, good body mechanics, patient safety, and my safety, privacy, and then we're going to begin. We would select the right syringe size and needle size. So the syringe size would be 1 milliliter, and then the needle size would be 25 to 28 gauge, 1/4 and 5/8 inches with a short bevel. So if we're taking it out of a multi-dose vial, we are going to make sure that we lay it on a flat surface. We are also going to alcohol swab the top. So when you're inserting the needle, beforehand we are going to draw up air at the amount that is indicated of our medication. So we would draw up air, and then once we have done that, we would place it at a 90-degree angle in our vial. We would make sure that the needle was above the fluid line, and then insert our air. After we're done with that, then we would draw it back with the amount of medication that is needed. So once we have withdrawn the medicine from the vial, we are also going to assess for any air bubbles. If we do have air bubbles, we are going to push the air back in or tap it, and then we would, if we need to withdraw more medication according to what the prescription order is. Before injecting the patient with the shot, we are going to make sure that we take an alcohol swab and clean off the area and allow it to dry before we inject. In doing so, in the process of injecting them, we are going to use our non-dominant hand to hold their skin taut, and then we are going to insert the needle at a 5 to 15 degree angle. We're going to go about 1/8 inch into the skin. We are going to inject slowly until there's a wheal that forms. Wheels should be between 6 to 10 millimeters.
Okay.
So when we are done, we are going to make sure that our syringe gets disposed of in like a biohazard or a puncture-resistant container. And then when we are done with that, we are going to go ahead and blot the area of the injection. And we're not going to put a Band-Aid on it. So if we are going to be recapping a needle, we are going to make sure that our cap is either against something that's like a hard surface, flat surface, or we could even use a cup and have it face the opening side up. So we would use the swoop method. And we would just kind of go in just like this and recap it, and then make sure it gets into a puncture resistant container or biohazard.